I think it's probably not for everyone. I think you probably have to have a certain personality or way to connect with your patients for this to work. It is all based on relationships, and they need to trust you because they're welcoming you into their home. And again, you're going to use the bathroom and they didn't clean the toilet today, and they need to trust you to be in their home. And I have talked to other nurses doing this who do their documentation while they're doing the treatment, which seems like it would be very efficient. They're hooked up for 53 minutes. You have time to kill. You can get all your documentation done in 10 or 15 minutes. But that's not what the people want. The people, they're very happy to have company twice a week. They know when you're coming. They want to talk to you. They want your attention. They want you to look at them. They want you to listen to them. They want you to know all about their family. So when they talk next week, when they say a name, you know who they're talking about. They want to show you pictures on their phone. They want a relationship with you. So I think as long as you give them that part of it, again, that's probably not for everybody. Not everybody is going to be good at that. But all of my patients that I have right now, all of them are in round 2 or round 3. They are all repeat patients, every single one.
That's amazing.
That's because of the relationship and the treatment.
That's so cool. Okay, so that really is good advice, right? Most nurses are probably not even thinking that, like the intimacy of being in someone else's home for simple things like asking for maybe a drink of water or using their bathroom, like what that patient might, have some anxiety over that, and how they have to trust you, like, to trust you. So that's great advice. That's great advice. Thank you for that. Any last thing that you would want to say to anyone before we wrap up and close up?
I would just like to reinforce that it is not a scam. It is not too good to be true. It really is true. But it really is work. It's fun work, but it is work. And there's definitely a time commitment. And like I said, an attention commitment with your patients. So as long as you're willing to have that discipline, get up every morning and do what you have to do, make those relationships, it's the best job I've ever had, for sure. No doubt.
I've had
a lot of nursing jobs, but this is the best one for sure. Yeah.
Well, thank you so much for all of your thank you for the knowledge, the wisdom, and your experience. I hope that somebody out there, watches this, listens to you, hears this, and it inspires them to follow your path, get into the world of mobile nursing, do something that helps people.
So. Yeah. It can help a lot of people. Yeah.
Yeah. So thank you so much for that. For everyone listening, you're listening to Mobile Nurse Revolution. And we look forward to visiting with you next time. And any questions, comments, thoughts for the show, for myself, or for Lori Setzer, who was our guest today, you can email us at info@mobilenurserevolution.com. And I'm your host, Dr. Will Bozeman. Thank you so much for joining us today, and we will see you next time.